Good evening and welcome to today's episode of Health Check. My name is Grace Mutiso. Now, from regular periods and painful ones to heavy periods and missed periods or stopped periods, women get different concerns when it comes to matters, monthly menses. What's normal and what's not? That's our focus of discussion tonight as I host Dr. Karen Muthembwa, an obstetrician and gynecologist resident, that's very important, is here to answer all your questions regarding today's topic. We are focusing on menses, and you can start sending in your questions. Our SMS line is 22232. That is 22232. You can also follow us through our YouTube and Facebook page. The handle is at Hope TV. Kenya will be sampling some of your questions on that platform. Keep the conversation going. Allow me at this point to introduce Dr. Karen to us. How are you doing, Dr. Karen?
I am good, Grace. How are you?
I'm fine. You know, I was really looking forward to today's session.
Me too. Oh.
For those who follow us on Hope FM, you know, they're like, we really need to see her. How does she look like? You know, we just love her vibe. And we're glad that today we are having you.
Thank you.
So let's get to the first question. So what's menstrual disorder?
Menstruation is a phenomenon that happens every single month in a girl as they grow up from puberty all the way to menopause. Just before menopause, that's when they will stop. So a lady will experience a monthly bleed that occurs, and it usually has a way you can count, and most people have 28 days on average between one period and another. So there are many people who experience problems with menstruation, and they vary from heavy bleeding to no period at all, sometimes painful periods, and they come to us because of these kind of disorders.
Okay. So help us understand. So what does normal menses look like? You know, for a lady who is very much okay on normal menses, how does that look like? Okay. Before we get to not normal.
Yes.
Yeah.
Normal menstruation is usually, first of all, the age is usually between around 12 on average.
Yes.
The others will start a bit earlier, and all the way to around 40, 45 years old. So if you have a period that comes in every month between that age group, every month, at least every month, or between 28 to 32 days, it usually comes around 2 to 5 days. On average, most people will have around 5 days period. Most people will have less, maybe 3, and others will have even up to 8 days or even 7 days.
Yes.
Then, of course, you're changing your pad at least, I usually say change every 3 to 4 hours, but they should not be very soaked during that time. So on average, maybe most people who maybe you use 3 to 4 pads per day, that is now what we consider normal. Yes.
And now let's get to, I don't want to say abnormal, but not normal.
Yes.
Kind of cycle. How does that look like?
Yes. So you'll find women who might experience a period before that age group, as I said. So they can start earlier. A young girl starting periods very early, then that is something called precocious puberty.
Like 8?
I've had below 8. 8, there are some who do happen to have that. They are on the outliers, a little bit on the outliers, but it can happen. But now below that age, then there is a problem. They shouldn't be having that. They should not be ovulating, or, you know, because they're still children, you know.
Yeah.
Or if you have after a certain age, you're still having bleeding, then you're expected to be in your menopause, then that could be a problem. The other thing is if you now have soaking pad, every 1 hour you're changing, or every 30 minutes you're changing your pad, that is a problem as well. There are those ones who don't have a period at all. You stay 3 months, 6 months, and then when your period comes, it's too heavy. You cannot even manage. It can last even up to a full month. 30 days of, you can be admitted for that. You can get things like anemia, and sometimes worse still, it can lead to death. Yeah.
So if anyone has any of those signs?
Yes, it's not the usual.
It's not the usual.
Yes.
Okay. So I know we've talked at what age, you know, a parent could be watching and saying, hiya, I think I've noticed my daughter has begun her menses early. So what's the first call of action for such kind of a parent?
Yes, if it happens below 8, sometimes you look at the child and even yourself as the mother or the mother of the child. If she's not living with a mother, you can find out whether in the family they start at around 8. 8 is usually on the lower side, but below that, if it's a child who has started at 6 or maybe at 5, or even a small baby who's having some what looks like a period. It is very possible.
What do you mean by a small baby?
A newborn baby.
Oh,
but
really?
you see a newborn, yes, which can be explained by other things.
Okay.
Sometimes it could be in the breast milk of the mother. There's a lot of hormones that are going into the baby in a way that baby is having what seems to be like a period.
Okay.
Yeah, they have a discharge that is reddish. Yeah, so that one is something that we may want to know. It would be important for a mother with a child like that to come. We see her, we investigate. It might not even be a hormonal problem, really. Most of the time it is, but they could also have a bleeding problem that has not been diagnosed yet. But now because their bodies, the only way the bleeding can come out is either maybe when they're brushing their teeth or now they're having what looks like a period. And maybe it might not be regular or so. So it would be good for them to not panic, but just to come so that we can be able to help the child. Yeah.
Okay. So help us understand what usually happens in a lady's body when it comes to this time of the month, in a simple language Wanjiku can understand. And also, there are men who are watching, and maybe they don't know. So help us understand inside a woman's body, what usually happens when this lady has normal menses, and then give us that picture when this lady has abnormal menses.
Okay. Menstruation is a complex thing that happens in our bodies. Our bodies have been created in a way that even for us doctors, we still learn new things about the hormones and interactions, but I will try and explain it in a very simple way. And I think for the audience or anybody who's listening, they just have to remember 4 hormones that have to play together in order for you to have a normal menstrual cycle. The menstrual cycle has 2 different cycles inside it. We have the ovarian cycle, and we also have the uterine cycle. So I will not mention the names of those stages because they're different stages, but I'll try and describe it in a very simple way. The ovary and the uterus work together, and that is why without ovaries, you will not have a period. And if without a uterus, you will not have a period. So they have to be there together to work together. And they're controlled by these 4 hormones. We're talking about something called follicle stimulating hormone, something called luteinizing hormone, estrogen, and progesterone. There are other smaller ones, but those are not of they don't really concern us as much unless we're looking for something particular. So a menstrual period is controlled from the brain.
The brain.
The brain.
All starts in
the brain does everything in our bodies. So the brain has something inside it that's called the hypothalamus, something called pituitary gland. I think if you've done some of the biology somewhere, you might understand that. So those organs work together to produce something called the follicle stimulating hormone and the luteinizing hormone. I'm sure that those patients who have had to have a test of maybe the follicle stimulating hormone and now it will make a little bit more sense.
Yes.
So this FSH, I'll say it, FSH is follicle stimulating hormone, and luteinizing hormone go down to the ovary through the blood. And as they go to the ovary, they now stimulate the ovary to start producing the eggs that are already there. They have to grow so that you have a mature one that can come out and be ready to fertilize. So this follicle stimulating hormone comes up, it increases in the body. This is on the day 1 of your period. So once your period has started, we call it day 1.
Yes.
So it starts to grow those follicles, they start growing. Over some time, there'll be that mature follicle that's supposed to be ovulated. That one that can be ovulated to form a baby. So that one, as it's growing, it's also producing something called estrogen. So I've mentioned 2 hormones. 3 actually, follicle stimulating hormone, luteinizing hormone, and the estrogen that's now being produced from that egg. So this egg, as it's coming out, it will need something to push it to ovulate, and that's where the luteinizing hormone comes in. So the FSH comes, grows the egg, luteinizing hormone comes in, ovulates it. At the same time, this egg is producing estrogen, which is telling the uterus to proliferate and become thicker, to be ready to cushion a baby.
Yes.
Yes. So it ovulates as the uterus is now proliferating and ready for receiving a fertilized egg. But at the same time, we have this thing that has remained, the space, which some people find you're being told you have a simple cyst, or you have that's the cyst now that can form at this point. But in normal cases, it remains as something called a corpus luteum, which now produces progesterone, helping the estrogen to grow that cushion in the uterus, allowing that egg, when it reaches, it is safe for landing.
Yes.
I hope that is as easy as... So all those 4 hormones work together. If in case this egg is not fertilized, it will land on that part. But at the same time, this corpus luteum, the one that was producing progesterone, has a time limit of only 14 days if there's no pregnancy. So within 14 days, it will shed off, it will die, and then it will remove the progesterone, because there's no corpus luteum. So that part that is supported by the progesterone starts to pour down. And as it's poured down, that's what we call menstruation. That's the blood that is called menstruation. A lot of interaction of those hormones, but all of them explain some of the reasons why a lady will have a problem with their periods. So most of the time, as I said, you'll have 14 days of that hormone helping the uterus to grow. So you'll find like the beginning of that was another 14 days. So most people have 28-day cycle. Others will have 32-day cycle. But that part in between where that progesterone starts to grow the uterus is always a 14-day cycle. And we are able to calculate backwards which day you ovulated. I hope it makes a little bit of sense.
Makes a little bit of sense. And I believe my viewer, it's making sense. And it explains a lot why I didn't see my period, why am I not expectant?
Yes.
For example,
if you didn't ovulate, say for one reason or another, like people who have PCOS, Polycystic Ovarian Syndrome or disease, if they do not ovulate, that egg, you remember it leaves the corpus luteum, which protects that, which makes that thing remain there. So if you did not ovulate, then it means there'll be no corpus luteum to wait for 14 days to shed. So you will not have a period. And that is why we call some things anovulatory cycles. So if you don't have a period, then most likely you did not ovulate. And that's why after some time, if you did not ovulate, let's say for 6 months, now once that body has got all those chemicals, have decided now it's time for this small thickened endometrium, the inner lining of the uterus, starts to shed more than it should have for the last 6 months. So you'll find someone having a time of no period at all. And then when the period comes, so much blood comes out, and it can even last even up to 30 days. So that's one of the signs of an abnormal period. And I hope it makes sense in terms of what really happens in this situation.
Okay. And Dr. you've mentioned, I wanted us to go there. So one of the signs of an abnormal period is too much bleeding. What are some other signs of abnormal menses?
A lot of pain. Bleeding, of course, is number one reason that brings ladies to us, because, it was abnormal, it was too long. Other people will have too long. The length is a problem. Maybe you're just spotting for 30 days. But there's that other one who'll have very heavy periods for 3 days, but it will really devastate their lives. So it can be too long, that's abnormal. Too heavy, that's abnormal. If you have pain while having your period, like there's a pain that stops you from working, from doing your normal activities, then that's abnormal pain. We expect to have some mild to moderate pain, because as that layer, the inner layer of the uterus is shedding, it usually sheds with a lot of, for it to shed, there are many chemicals. We call them prostaglandins that work to break it off, because it is a thick thing, it has to be broken down. So those things can cause you to feel some pain because of their interactions. But when it's too much, then that is a problem. Another problem with menstruation is if they miss periods for too long.
It's too long, Dr. It could be
more than
just a month.
Yes. Okay, maybe you have a 28-day cycle. And by the way, maybe I need to make it clear that the fact that you have 28-day cycle does not mean that you'll expect your period on the 15th of every month.
Ah, why do you say so, Doctor?
The mathematics. So if you have a 28-day cycle, if you started on day 1 of this month,
Yes.
let's say it's the 1st of September, and it lasted 5 days, yeah? So you've started 1, 2, 3, 4, 5 until day 28. Day 28, you expect your period to come on the 29th day, yeah? So that means the next period will come on the 28th of September. Then September has how many days? 30 days. So you'll start on that day 29 becomes your first day. That means the next month, you will not get the period on the 28th, right? You'll get it a bit
Earlier.
closer, yes, right? It's earlier,
Yeah.
yes. So it doesn't mean that if you have, it comes on the 15th, the next month it comes on the 12th, it was a problem. You just need to know how many days in between is your regular period.
Okay.
Yes, 32 days also the same thing. You might miss, in that month, you might not get a period because if you started on the 1st of September, your next period will come on the next month, a certain day, maybe the first few days of, yes. So it's possible that if you have elongated days, around maybe 35 days, you might actually not have a period, maybe 1.5 months. Yeah, it does not mean that you're abnormal. If your periods are 21 days, it means you can have a period on the same month, 2 periods in the same month. Yes, so it's not about the dates, it's about your number of days. Yeah, so, but for those ones who are obviously having a problem, then it will last long. So it means in a year, you're getting less than 9 periods. Less than 9 periods.
Okay.
And I know you cannot count 9 periods, but you will notice that from the 20, you used to have 32-day cycle, and then suddenly it's coming after 2 months, or it's coming after 6 months, then that is amenorrhea, a very long period of no period. Yeah, it's usually very clear if it's abnormal from what you're used to, or it's coming too early. That's also another reason to worry.
Yes.
Yeah, but there are normal things that can cause you to miss a period.
Like which one?
Like pregnancy.
Oh yeah. That's the first suspect.
That's the first suspect. If you miss a period,
Yes.
and you know you have been sexually active,
Yes.
it would be very important to have a pregnancy test done. At least rule that out before.
Yes.
But we can also do it for you. Yeah. Another way you can miss your period is if you're going into menopause. That's also a physiological thing.
At what age does that happen?
From 40 and above.
40.
Anytime from 40.
Okay.
Yeah.
Menopause.
Menopause, right. And then, of course, if you're young, there's a certain time you will have a period of no ovulation. Maybe you change schools or you change environment or you're eating different, you're under stress and all that, then you can also miss a period. So those 3 things are normal. They're normal.
Yes.
At least, even if you're not sure, it's good to confirm with us, so don't ignore it as well. But it's possible to miss a period during that. But during the other normal age that we expect a normal period to come, you should note your days and know whether it has changed or not.
Okay. You know, Dr. Karen, you've mentioned simple things that could affect your menses. And I know for parents, and even adults, we don't take heed to it, like change of environment. Weight,
Yes.
moods. Ebu, tell us about that. Or change of school, you know? We
Yes.
teach our children schools like...
A lot, and
You know.
sometimes it affects their bodies. So, as I said, remember the menstruation comes from the brain.
brain.
The brain controls a lot of what we do. And if you're under stress, it just tells it's a hypothalamus. We have the hypothalamus and the pituitary gland.
Yes.
Those 2 organs work together. And the hypothalamus is affected by things like stress, strain, weight loss. Extreme weight loss can cause you to miss your periods. Extreme exercise, which is also a lot of strain on the body. The brain just says, you know what? We're not going to do this. This is too much. So we stop what we are doing for now until we regularize our things. We talked about even the diet. If you're missing some things, and you know, like people who have issues with eating disorders, such as anorexia, bulimia, they will also have issues with the control from the brain.
Yes.
Yes. And of course, even the hormones rely on some nutrients in your body to be able to work the right way. Yeah. So these simple things in the environment, the weather, sicknesses, diseases, anything that increases your cortisol levels, stress levels. I think I've talked about cortisol all the time, which is usually a stress hormone. So you must, you know, stress relief is a very important thing in how we control our bodies. So that, even obesity. Obesity is one of those things, as much as we say love yourself the way you are, we have to remember that we also need to control our bodies in a way that it is working at its optimum. Obesity increases some of the hormones like estrogen, which disrupts a lot of our hormonal, how our bodies work, you know? Yeah, and it affects men too. Yeah, because you'll have more estrogen as a man if you're a bit on the overweight side, because you'll tend to find there's a lot of estrogen which is causing them to add maybe the breasts. You'll find they'll have actual breast tissue.
Yes.
It's not just fat, that's breast tissue because of the estrogen level. So obesity is one of those things that it's not easy to manage, but it's possible to change.
Okay, thank you. I'm hosting Dr. Karen Muthembwa, helping us discuss this interesting topic about menstrual disorders and inviting you to be part of our conversation. Our SMS line is 22232. That is 22232. You can also get us on Facebook and YouTube. Our handle is @TopTV Kenya. We'll be sampling some of your comments and questions on those platforms. If you have any, Dr. Karen will be glad to answer you. So, Doctor, you mentioned about endometriosis, you know, earlier on when we talked. So what's the difference between endometriosis and normal menses pain?
Yes. Endometriosis, for those ones who don't know, is a condition that when you have, you know, that inner layer of the uterus, when you find those tissues of that inner layer of the uterus in other places other than in the uterus, and that can happen to different people. We cannot even say this person will get. We cannot determine whether this person is possible, or predict that this person will get, but it can happen. So if you find that tissue in other different places, that tissue responds just the way, like when the estrogen and progesterone start to control the inner lining of the uterus, it's also controlled the same way. So when it's supposed to shed, those chemicals that shed it also shed inside wherever they are. They can shed inside the where the intestines are, on top of the bladder. It can shed anywhere, even in the lungs, in the brain, anywhere in the body. And that now causes a lot of disruption in the body. So you'll find severe pain. If the endometriosis is just in the abdomen, the period pain will be heightened. Now it will be severe in a way that you even have vomiting, diarrhea. Sometimes you can even have blood in the stool. You might have a lot of pain while passing stool. So it's quite devastating. Other places, let's say if you're bleeding from even the nose. I know that's very far-fetched, but it's very possible. You have nosebleeds during periods. Or you have if they're in the lungs, then you're always drowning in your blood every single month. So that pain is usually extreme, severe, and most of the time it will start when girls are a bit younger, around 20 years old, or even depending on when the endometriosis started.
So is there a relation between those two?
The menstruation and endometriosis? Yes, because the hormones that control the menstruation are still the same hormones controlling those tissues everywhere. So they work like just the inner lining. So they just pour blood when it's supposed to pour blood. They thicken when it's supposed to thicken. So it gets worse over time unless it is managed early.
Okay, Valsava. Oh, that's a bit scary.
Yes, it's a devastating condition.
Yeah, the first, if you could be talking and a viewer could be thinking, doctor is really prescribing what I experience every month. So what's the first call of action for such kind of a viewer?
The first thing would be just visit the nearest gynecologist. The beauty is that even general practitioners are able to identify. They might not be able to, not everybody is able to diagnose at first. Yeah, but there's some medication you can give and say it could be endometriosis. or we can run tests. And one of the tests that we usually do is to do laparoscopy, which helps us identify those tissues. We take them to the lab. Sometimes we remove those tissues, and then we take them to the lab and then confirm that it is endometriosis. There's one particular endometrioma that's very common. It's usually around the umbilical area. Yeah. People will think maybe it's a small pimple, but that pimple around the umbilicus starts to pain, especially during periods.
Yes.
And it swells, or it can even produce some liquid. That could be an endometrioma. So from even what I've described, I'm sure if there's anyone who's watching that, they will know, oh, I might be having an endometrioma of the umbilical area. So if they note there's any of that, or severe pain during your period, or you're having other symptoms like vomiting or bleeding from somewhere during your period, then you might need to see a gynecologist on that note.
Okay.
Yeah, but don't panic again.
Yeah.
These are things, that's why we learn what we do for many years.
Yes, yes, to help us identify.
Yes.
Yeah, and to remind you, 22232 is our SMS line. Please keep those questions coming so that Daktari can be able to answer you. Before we wrap up the program, we still have a few minutes before we wrap up this program. So, Daktari, are there some diseases that are related or cause this menstrual disorder?
Yes, depending on the disorder. So I'll talk about maybe heavy periods or prolonged periods. There are many things that can cause this. For example, it could be from the body. Let's say if you are a lady with a bleeding disorder, you might have heavier periods than other people. For example, if you have something called von Willebrand's disorder or factor, that is, deficiency, then that one, you might have a heavier period than usual. If you have a bleeding disorder, you'll probably bruise easily also. Maybe if those ones who are thinking, maybe I have one or not, maybe if you brush your teeth, they bleed very easily. Or if you just cut yourself, your bleeding is not clotting as fast as it should, and now you have heavy menses, then you might need to check that as well. Some medication can also cause heavy menses. For example, if you're on things like NSAIDs, for example, like which are diclofenac, or let me talk about aspirin, actually. Aspirin would be one of those medications that can disrupt your clotting mechanism in a way that you now can bleed easily. So if you're on that medication for a different reason, it would be good to see maybe it's a cardiologist who's treating something else, and you're having heavy menses. You can see the two doctors at the same time, so that we can titrate whatever we are giving so that it can work for you. Yeah. Another thing is warfarin.
What is that?
Warfarin is medication we give if you have a clot somewhere,
okay,
including heparin. Warfarin and heparin. They're usually drugs that we give people who have any clotting disorder. For example, if you have something called a clot in the vein, which is DVT, deep venous thrombosis in the leg,
yes,
or a clot in the lung, or a clot anywhere, or if you ever had it and you're on that medication for a long time, then your blood it does not clot easily. So it's possible to have heavier menses. So those two particular groups, we usually investigate further and find out what could be the issue before we do anything. The other thing that can cause disruption with your period, like heavy periods, is in the uterus itself. If you've had conditions like diabetes, hypertension, sometimes you have issues with obesity, then you can have something called hyperplasia of you see the thicker lining inside the uterus?
Yes.
This is why we described it all at the beginning. That thick lining becomes thicker than usual. Okay. That can also cause a lot of heavy bleed, because you remember, it's a lot of it that needs to come out. Yes. Or if you've had an ovulatory cycle where you've not had a period for over a long time, then when you get it after 6 months, you're bleeding a lot. So those are uterine factors that can cause that. Another thing that can cause that is if you have an issue with your ovaries. In patients who have an ovulation, the way I've said, an ovulation, you have no period over a long time, then after some time it is very heavy. If you have PCOS,
yes,
Polycystic Ovary, this is something we've been discussing for a while, and it still doesn't get, we still get more information every time. That one is also something that causes an ovulation, and then you have very heavy menses. It trans even to if thyroid diseases. So if you have thyroid disease, you might have heavy or no periods at all because the thyroid and other hormones work together and then help you have your normal menses. So if you have any thyroid disease, you might actually have disruption in your periods. That's for heavy menses.
Yes.
For those ones who have no periods at all, first of all, we are checking for pregnancy.
Yeah.
And there's no pregnancy, we look for other reasons that cause that. It comes from the brain again. If you're stressed, you're not eating well, you've changed your any diet, or you've gone to a different environment, anything that could be disrupting something about your brain can actually cause you to have amenorrhea over some time. Like I said amenorrhea because it's no period. It means
Yes.
a lack of a period.
Yes.
So it starts from the brain. It can be also ovarian, like it comes from the ovary. Like if you did not ovulate for one reason, then you will also have that amenorrhea, like in PCOS again.
Yes.
PCOS can present in two ways. Yeah. So, but there are other things that can cause bleeding before we say that it is just a menstrual disorder, like fibroids, you know, and if you have adenomyosis and all those polyps, those are other things that we don't really classify as abnormal uterine bleeding.
Yes.
But it can be one of the causes why people would have maybe in between your periods, you have a bleed. Yeah, so that's what differentiates a menstrual disorder with an actual structural problem.
Okay.
Yeah, for periods, you can even have in between polyps, cervical cancer. There are many.
Yeah.
There are many.
Okay. Sawa. Let's try to sample a few questions that are before we get on a break. The first one says, what causes one to bleed for weeks on end, though not so heavy and with no cramps? I used to have a normal cycle. I did the hormonal tests and they all came positive. Is there something that can be done to have a normal cycle again?
Okay. As I said, if you have an ovulation, you're probably going to have a period of no period, and then at some point you have now heavy or prolonged. So you can have prolonged, but it's light. Like she's saying, has this prolonged but light. So with such patients, we can actually start them on medication depending on their age, whether they have children or not,
yes,
and what they want and what they really want, you know, because if you're 20 years old, she didn't give us, she's how old?
No, she didn't
give
tell
us her age. If she's 20 years old and she has this prolonged period, I think they must have done a few hormonal tests, which I said, the 4 hormones that we will always be checking for.
Yeah.
You'll hear FSH, LH, you'll talk about estrogen, progesterone, and we want to see their interaction. So I don't know what positive was, because there are times when each should be at a certain level. So we usually review that hormonal test, and it's quite expensive, actually. It's not as cheap. But before we do that, sometimes we can be able to stop that kind of bleeding, depending. If we suspect there could be a blood disorder, we run tests, we check for your HB, level of blood, we check your platelets. Those are the ones that help clotting. Because it means if you're bleeding for a while, maybe there's an issue with your blood, if the hormones are okay. Yeah, because she says her hormones, I guess positive is okay.
Yes.
Then we need to check whether there's a blood disorder. Either we look for those factors, we look for the platelets, we look for something called coagulation profile, and
That's
see
a
whether
big term.
yeah,
What?
how you coagulate, how you clot, because
Yes.
clotting is important. Bleeding is also important.
Yes.
So we need to have a balance. That is, it's now a balance. Eh?
Yes.
So that thing we look for tests for that balance of whether you're clotting well and bleeding well.
Okay.
So that coagulation test we have to do. If they're all fine, then we can assume that there's an issue with your hormones. Even before we do this test, we can treat preliminarily. We can, depending on how old you are, if you're 20 years, maybe 24 or 25, and you're having this kind of an issue, we may start you on hormonal treatment. Because what happens if we give you a combined oral pill, which is the most common thing we will give after we've tried to treat bleeding disorders,
Yes.
including if heavy bleeding, we give you some medication like we give you some medication that help you stop that bleeding. But if that's not working, we can do combined oral pill, which helps to stop the brain from, it starts again from the brain, stops the brain from those parts of the brain from your usual normal the way it is working, and then itself, it now regulates on its own.
Okay.
So it's the purpose of the COC, what we say COC, is not for stopping fertility, but it will for that period only, but at the same time to regularize your period. It gives you an actual date, by this time we will expect a period, by this time we expect a period. Over some time, as we monitor you, as we see whether there's any other outside issue. The other things we can give if a patient is not able to be put on combined oral pill and they're still young, we can use progesterone, or we can use the IUCD, the coil that you put inside with progesterone. It helps to stop that kind of a bleed. If they are older, let's say they are in their 30s, depends also on whether they want to conceive or not, because if they want to conceive, then we can allow them to conceive, then that will stop the bleeding as well. If not, then we use the same method like if you're in your 20s. Because again, we cannot remove your uterus if you have not gotten children. But if you're above 40, we look out for things like the thickening, the hyperplasia of the uterus, the thickness of that uterus. And then if there's an issue with that thickness of the uterus, we can see with the scan. If it is there for sure, we take a sample, we check and find out whether it's the normal thickening. There's a thickening that's not cancerous, and then there's another one that could be, or it has started to change.
Okay.
So we can actually try and remove that thickening of the uterus. So there are many, many things that we can do. If you're above 50, maybe, and you're still experiencing that, and you're going to menopause, you're done with getting children, then we can consider actually removing that uterus, and then now you don't have that part that's bleeding.
Yes.
Yeah, and then you can, but you can live without a uterus.
Okay.
Yeah.
Wow. She's called Dr. Karen Muthembwa. She's a resident obstetrician and gynecologist, helping us with a discussion today about menstrual disorder. We can see your questions coming. And after this break, we'll be sampling more of your questions on 22232. My name is Grace Mutiso. So let's have this quick break. We'll be right back.
Hope TV is now available on GoTV Channel 103, Zuku Channel 873, Signet Channel 817, and Star Times Channel 026. Enjoy our uplifting content and family-friendly programming anytime. Hope TV, you look and live.
Okay, welcome back and to Health Check. My name is Grace Mutiso. We're just trying to have a small chat with Daktari. Now, let's sample some of the questions, Daktari. And this one says, where does all the blood come from during periods? Let's answer that one first before we go to the second and the third one.
Okay. You remember the thickening of that uterus?
Yes.
Inside, the inner layer, that inner layer, when the hormones that make it thicken, in preparation for an egg to go and, just find a cushion, get itself in there. It's like it prize and eats everything there so that it can make a baby. But if there's no baby, that thickened layer cannot remain there. Yeah, because remember there's a corpus luteum that is now breaking down if there's no baby.
Yes.
So there's no progesterone. So that tissue breaks down, and that is what now the tissue becomes blood. Yes.
Okay, there we go. What are Bartholin cysts? Where does it occur? And what is the treatment? I'm not sure if it's related, but let's go.
Bartholin cysts is not related with the menstruation,
Yes.
but it's part of the organ of the woman. So at the entrance or the exit down below, there's usually canals that allow us to have the normal discharge and all that. It's normal to have a level of discharge. Now, that Bartholin's gland is the one that produces, it helps to keep the normalcy of the vagina down there. So if the duct has it's like a small pipe that leads inside there, which can block, and it can block for different reasons. Either because there's a lot of clog, there's a lot of, maybe there's infection or whatever, it can block. And once it blocks, it now the fluid cannot pass, so it becomes like a ball, like a balloon, which contains fluid inside. So that's what we call a Bartholin cyst. It can get even more infected and get, it's called it becomes now a pass-filled thing, which becomes an emergency. Yeah. So that thing can be, what we usually do is we remove the cyst, if it is just a cyst, or if it is with pus, we also remove it and then we leave it open. And then the patient is okay after that.
Is it a complicated procedure or it's a day?
Yeah, you can do it in a day.
Oh, sawa.
But preferably in a theater setup.
Okay.
Yeah, it will be a bit, the pain management is important.
Okay. When should one expect menopause to hit?
Menopause is I wish we would even discuss it because it's a very interesting topic.
Yes.
It's not a disease, first of all. It is a stage. Yes. It's like the way we have puberty. We're now in reproductive, and then now we go in menopause one day, one time.
Yes.
So it's not a disease, first of all. So it's going to happen to most of us. Mm-hmm. So it can happen anytime from 40 years and above. There are people who get it a bit earlier. So you'll find maybe at 38 they stop. It's a bit early. But from 40, you should expect to have changes in your periods, which can be a sign of going into menopause.
40. Okay. This one says, Daktari, a mother from Migori, if I carry heavy loads, I see my periods. What could be the problem?
It can mean many different things. That means there's a bit of strain when she carries something. When you lift something, your stomach it's like the muscles become tough.
Yes.
It's the same thing. We call it a Valsava Maneuver. When you press like this, you are able to puke, you're able to cough, you're able to go long call, you're able to pee.
Yes.
So it means there's some force she's exerting, which is causing the uterus to either the uterus or anything that is inside there that could have an issue to remove the bleed. So there are many different things, either, unless she's examined, that's why it's easy to know where it's coming from exactly. But if she's having a bleed, she needs to go and get a doctor to see, because it could be from the uterus, as I said. When you exert a bit of force, the cervix is releasing that blood to pass. Or it could be even from the cervix itself. Maybe it is holding some blood there, which has come either from the uterus or from there itself, which is coming out. So it's like the way you're also having a period. Yeah. Sometimes if you push out, you'll also feel that blood comes. It depends, yeah? Yeah. Or she's having a clot inside. There are many different reasons for that, yeah.
So she needs to be checked?
Yes, yeah.
Okay. I've been having regular menses, but I missed my periods this month. I'm not sexually active, but I had a bad flu. Could it be related that is from Kathy?
Yes, any infection, any stress level can make your brain again decide this month it's going to stay a bit longer, But you're sure you're not pregnant, you may just need to just do a pregnancy test for sure. She said she's not sexually active, yeah. which is good. But as long as we are sure that there's no pregnancy, it's important. Then again, give it some time. It may come and regularize. Because again, there was an incident of flu. So if it doesn't come back, maybe it takes another 1 month, then she can see a doctor.
Okay. Is it possible to have periods twice a month?
Yes, we discussed
about it. It's possible.
It's possible. If you have a 21-day cycle, it's possible that your period will come on the 21st day of the same month if it started on the 1st. Or the 22nd day. So you'll have 2 periods in a month. Yeah, but if that's not your usual, then that's not right. So that's a difference. If your usual is at least every month, then if it comes twice in that month, and your days are not those 21 up to maybe 28 days, because even 28 days you can get the same month. Very possible, yeah? Yeah, then if it's different, then you may need to see a doctor.
Okay. This one says, I'm a pastor and a father of 3. My firstborn is 18 years and has not started her menses. Her follower sister is 16 and already has. Family history is that one of her maternal auntie never had menses. Please help. This is a pastor listening to us from Western Kenya. We salute you, Pastor.
Hello,
Yeah.
yes. We do our cutoff usually at 16 years. But even if, let's say this, we look at other things. There are stages of growing. And these stages are, we look at the breast development, hair distribution, and all that. So by the time you have hair distribution, we expect your period to come. But if you don't have development of breast, hair, and your period does not come by the age of 16 years, then it would be important to see a doctor because the puberty has not taken place. The stages have not taken place. And they can happen in different patients.
Yes.
Thyroid disease, diabetes, a lot of things. If those hormones, because those are all hormones.
Yes.
If they are not controlled, then it's possible to get a child who does not go into puberty, yet they are above 16 years. But if you can see that they're developing and their period has not started, there could be another issue. Sometimes we get some people with what is called a septum. See where the period is supposed to come out?
Yes.
The hymen. So it's not perforated. You know, there's usually space. But if it is all blocked, then you might be having a period, but it's not coming out. Yeah, so it would be good for her to see if she's developing and you can see there's no period. So it would be good for us to look out for that because maybe she's having a period, but it's blocked. It's inside. We can't see it, you know. So that is one of those things. And again, if for sure you can see in the family that it's not normal. It's not. We don't expect that you don't ever have a period, ever. So I don't know whether the auntie got a child or not. Because without a period, it means she's not ovulating. So it would be good for us to examine her, check her ovaries and all that. But if she's having development, then it's a kind of a good sign because there's a movement to the direction. At least her hormones are okay.
Okay.
Yeah.
And we celebrate every man, you know, every father
who's
who's really
trying and looking at, you know, and knowing what is happening because not many know even whether the children have had their period or not.
So we celebrate every
Right.
man. How normal are the pain, especially to a 15-year-old, and what should be done? That's Martha asking. How normal is that pain for a 15-year-old?
Okay, I want to maybe correct, maybe if it's me. I said pain is not normal, but we can experience some pain, okay? I know that's doctors, we always talk like that. Maybe the injection is not too painful, it's just a little bit of pain. But yes, pain should not be normal, but there's that one that is acceptable in a way that you can be able to exercise it off, or you can be, you know, if you're able to keep yourself busy, your brain busy, doing something and the pain can go away, that's okay. But if the pain is overriding what you're trying to do, including maybe simple paracetamol that you can take in the house, it's not working when you try to exercise, when you cannot even get out of your bed, that is now very severe pain. Then you know there's a problem. Even for a 15-year-old, some of them can be very tolerant to a lot of pain. So if they complain pain, then it would be good to actually look into it because even them, they experience things like even endometriosis can occur at any time. Yeah, and some of them are more sensitive to the chemicals that are working on that inner layer, and they feel more pain than usual. So it would be good for us to still again examine her, see. Stress also can cause a heightened pain. Yes, so it would be good for us to be able to examine if it's stopping them from doing their normal activity, including school and exams and playing. Yes.
And meeting with their friends.
Yes.
Okay. Please take her for check. Esther from Kikuyu, thank you so much for watching. You're saying on ovarian cyst, causes, cure, management, etc. I'm learning. I think that's a topic maybe Daktari one day our producer Eunice will organize for us that one so that we come and talk about ovarian cyst. But just to encourage, what usually happens and how can she get help?
Yeah. You remember when you're talking about the ovulation, when it ovulates, that space that was left, that when it closes up, it can pick up fluid. And that fluid becomes like a small balloon that can even continue growing and growing and growing. Some might have one cyst, another person can have 2 cysts, and another person, the one cyst that's so big until the stomach is like a pregnancy.
Yeah.
So they vary and they range. So if you have a small, simple cyst, we call them simple cysts, some very, very common. It is just that cyst that can easily even, I don't say maybe burst, or the fluid can come out and then it's over. That's it. As long as you have normal hormones, it will just regularize itself. Every woman can form a cyst at any one point, but the body has a way to treat it, and it goes away. Some of them, they recur or they remain there and they cause a bit of pain. Actually, some people have a lot of pain during when they have a cyst. They can even tell you, hey, I think I have another cyst coming up, you know. It's quite painful because of the strain on that balloon.
Okay.
If it is less than 4 centimeters, we can manage with medication or even just pain relief, so that by the time it pours out, you're okay. If you have a big cyst, more than 4 centimeters, we can be able to remove it using minimal access surgery to remove that cyst, but leave your ovary, it will still be fine. There are rare cases where we have cysts. Polycystic is many cysts, but it's different from this simple one cyst.
Yes.
There are rare cases of cysts that just remain there, especially if you're older, because some of them develop into some cancers, but they usually stay longer. They don't just, disappear and come back, But if that persistent one is there, it's important for us to check the ovaries and find out whether there's any other issue with that patient.
Okay.
Yeah.
Our viewer from Bungoma, Raquel, how are you doing? And thank you for watching. You're saying you're 40 years old and you missed your periods on June and July until last week on 26th. Is it a sign of menopause? Will I ever have children?
Okay, she's 40 now.
Yes, 40.
Yes. From 40, we expect some level of change in your period. Other people, it will start, there's something called perimenopause. Is before menopause.
Yes.
So perimenopause is from 40 and above. Menopause from 45, most people will stop having their periods. But there'll also be other signs that there's menopause, things like hot flashes, where you feel heat coming from the back, even going up to your neck. It irritates you. You get angry easily. At the same time, your period is either missing or you're having too much of it, So that could be the other signs with menopause. So if she has missed 2 months, she can observe it. As long as she's not pregnant, we even can get a pregnancy, even if you're in conversion. There's something called menopausal babies. Yeah, they can come in because your body is not sure when you're ovulating today. When you're not ovulating, the day you ovulate and then you're not on a contraceptive, then you get a pregnancy. So it will still be important for her to do a pregnancy test before saying it is menopause. If not, she can observe and see. With other symptoms, it can also be a sign. Some people don't even get the symptoms at all. Yeah, there are many symptoms, by the way. That's why menopause is a very big topic.
Yes.
But a nasty experience, but a good progress. It gives, it's a good topic we can discuss.
Okay. Another one asking, what causes irregular menses and does it cause one to delay in conceiving?
Yes, I think even the other question was whether she can conceive.
Yes.
If she's not pregnant and she's missed her period, there's a possibility that she did not ovulate. If you ovulate, then you will get a period. If you don't ovulate, you will not get a period. So most of the people who have periods of no period, it could be because they did not ovulate.
That's irregular period.
Yeah, like it's coming when you don't know. That means your hormones are not well balanced because even your egg did not, because the egg needs to come out, and when it comes out, it needs to give you progesterone, and the progesterone will help you go into a period.
Yes.
So without progesterone, you cannot have a period. So it's just the combination of all that. So if you do have irregular periods, assuming you're having a period after 2 months, so maybe just before that period came, you might have ovulated at some point, but we cannot say where exactly you ovulated. So it's possible to conceive with irregular periods. The only issue is that you won't know when you conceived. You won't know which day.
Yes.
We can start calculating from. But also the possibility of missing the egg. If you're having an irregular period, even when Mzee is there, you don't know when to be together to get a pregnancy. So it becomes a bit more difficult to follow up when you can be able to conceive or not. Yeah. But if it is irregular, we can manage. We can be able to manage your period.
Okay.
Yeah.
I give birth 2 years and 7 months now. No menses. I ovulate as usual, and when I'm ready for period, I only see a dark dot over blood. I'm worried. Please help.
If there's no period, there's a chance that there was no ovulation. I think she might be talking about if she knows she's ovulating, maybe she's feeling the pain. Maybe it's a cyst, we don't know. But if you're not having a period at all, the chances is that you did not ovulate. So it will be a bit more difficult to conceive. Yeah. So, and the dark dot again is because your body is not sure when I should be bleeding, when I shouldn't. That's why you hear we talk about a lot of hormonal imbalance. Those 4 hormones that we keep talking about, and it will be good for us to investigate why is it like this so that we can be able to help her.
This one asking, is it normal to get discharge every day?
It depends on what discharge. There's the normal and there's the abnormal.
Yes.
The normal discharge is that one that you did not have an issue with. If I should say that.
Yes.
It may be clear, depending on the time of your cycle. It can be white, it can be sticky, depending on what time of the cycle. It's also a whole topic, but there are times when it is different, it looks different, but it does not smell. It does not smell bad. It does not, it is not too much. Although in pregnancy, you can have a bit of the normal discharge that can be too much of it, which is expected. So that is the normal.
Yes.
And it can happen every day because you have a different cycle every single day. I mean, you're on a different day of the cycle every day. But if you're having a discharge that's a different color from what I've mentioned, or it could be white, foul smelling, or it has changed into brown, maybe it's mixed with blood, or it is green, or it is a color, gray color, or it is clear, but it smells bad, then that is abnormal. You shouldn't be having that kind of a discharge at all. Yeah.
Okay. There is a question here, Dr. I know it sounds out of your scope completely, but we are also here to do ministry as a station, Hope TV. There is one of our listeners who says, just asking us to pray for them and also some guidance. Anne Fred, watching us from Perth in Australia.
Wow.
And she says she has depression and is even cutting herself. What help can this viewer get?
I really get her. I really, depression is very tough. It's not easy. It's even worse than sadness. So you can have, for her, I don't know what is making, because it's very deep. I really feel it for her, but it's possible to come out of it. You have to fight and pray, because I know she's watching this because she wants an answer. Prayer works, meditation. I know she might have tried all that. But if you've tried all this and you feel like you can't do it yourself, you'll need to ask for help from any psychologist or psychiatrist, anyone who can listen, even a counselor. It doesn't matter what you want to say, just go sit, tell them how you're feeling. You can even go and keep quiet. They will help you in your direction of what to say, what to do. Cutting is also one of the things. It's like diverting the pain that you're feeling into physical pain, because the emotional pain is quite heavy. It's heavy. So what I would tell her is to just give her strength. We are here together. We work together, not just alone. She shouldn't be alone. Talk to somebody, call somebody who you know will kind of give you some light at the end of it. Pray, God is there.
Yes.
God will help you. Yeah, and it's never the end of the road.
True.
It's never the end. There's always a light at the end of the tunnel.
Yes, thank you. Thank you, Dr. We have to call it a day right there, and please seek help, my dear viewer. Don't die with that situation alone. The Lord is there for you. Your parting shot, Dr. before we say goodbye.
I enjoy menstruation. It should not be a sad moment, even if you have premenstrual, which can be, you feel, there are people who feel dull, sad. They might even project it on other people before their period. It's called premenstrual syndrome. It is a time when you can decide to be doing certain activities to change that feeling, get yourself active, get yourself in positive moods. It's possible because menstruation should not be like a torturous thing. It should be a beautiful thing, and it should be experienced with greatness because it's a womanly thing, and it's a beautiful thing that God gave us so that we can be able to also conceive. It's a sign that we can conceive. So take it with positivity, and if there's any issue, that's why we are here, to help you with your menstruation.
Thank you, Daktari. She's called Dr. Karen Muthembwa, a resident obstetrician gynecologist, helping us with this topic about menstrual disorder. I believe you've learned the same way I've learned. And please, this video is up on YouTube and Facebook. Share with somebody you know really needs to watch it and get help. And of course, we'll be repeating this session. Madam Director, when are we repeating this program? Tomorrow morning at 11, right here on Hope TV. Catch a repeat of this program. My name is Grace Mutiso. I wish you a blessed evening. Keep it Hope TV. Look and live. I'm sure the newspaper, I can see them running up and down, preparing something special for you. Don't miss out on that. God willing, we'll meet again next week, right here on Health Check. Have a beautiful one. And thank you, Dr. Karen, for being a blessing to us.
Thank you.
Amen. Bye-bye for now.